Hello, everyone. Thanks for being here today. I'm Dr. Michael Streitmann, Westlake Dermatology in Houston, Texas. And today we're going to talk about cosmetic surgery for men. Cosmetic surgery is usually about 90% female, usually only about 10% male. In my practice, it skews more to almost 20% male. Don't really know why, but I'm happy to operate on male patients. Let's see if we can get the slide to advance. There it is. So first we're going to talk about liposuction and gynecomastia. Gynecomastia is abnormal enlargement of the male breast. All men have breast tissue. Uh, Usually it's a small little bit, but it can enlarge for several reasons. The most common reason is we don't know why it enlarges. It just happens. Other things that can make male breast tissue enlarge include marijuana usage and soy milk, believe it or not, has weak estrogens in it that can make the breast enlarge. So treatment of gynecomastia using liposuction can be done under local or general anesthesia, 1 to 2 hours, pretty quick. Sometimes tissue is directly excised from the male breast, usually through a scar around the areola. Uh, Men who have enlarged breasts usually have a very well-defined crease under the breast, and that crease has to be broken to allow the skin to redistribute. So I think that's one of the keys to the operation. You can literally go back to work the next day. Full activities in 3 weeks, and you're wearing a compression garment for 4 to 6 weeks. So here's some before and after pictures. This is a gentleman that's in his late 40s. You can see in the before picture in the upper left that he has a very well-defined crease, and that kind of defines the breast and makes it look a little bigger. So he had some liposuction through the areola, so there's no real visible scars. And you can see in the bottom pictures that there's still contour there. The worst thing that you can do is to over-suction someone because the male breast has shape. It shouldn't be completely flat. Rhinoplasty is very common in males. This is a general anesthesia operation. Hard to do this under local. I wouldn't want it done under local if it was me. You can go back to work in 2 days if you have a desk job, 7 days if you have a more physical job. Full activities in about 3 weeks. It takes about a year to see your final results of rhinoplasty. There's beneficial scarring that takes place inside the nose that makes it more well defined as time goes on. And if you have any breathing issues, those can be addressed at the same time. So here's a before and after picture of a male that did not like the width of his nose. So his nose was broken and reshaped, and even the nostrils were brought in at the bottom. This was literally only a week after surgery. He was from out of town and had to hit the road, but he has little scars around the base of his nose where we brought the nostrils in tighter, and it was a pretty good result. Most common reason that most men have a rhinoplasty is for a hump on the nose. This fellow did not like the hump on his nose, didn't mind the way his nasal tip looked. His nasal tip looked great, so we didn't touch it. So as you can see in the second picture, the after, his nose is completely straight. A male nose should be completely straight like that with no dip. A female nose should just have an ever so slight dip. Upper eyelid surgery is the most common cosmetic plastic surgery that men do, even more so than liposuction now as the population gets older. This can be done under local anesthesia in the office, less than an hour. We remove the excess skin and fat and muscle. I like to use dissolvable sutures. Some docs like to use ones that aren't dissolvable. You can go to work in 2 to 7 days. If you're not using any sedation at all in the office, you can literally drive home. Full activities in about 2 weeks. So this gentleman here, excuse me, had his upper eyelids done. And these pictures are only 6 weeks after surgery. The scars are completely hidden when the eyes are open. You can actually see the scars when the eyes are closed. And he had quite a bit of hooding on the lateral aspect of his eyes. that you can see better in this picture here. So the before on the left shows the hooding, and then afterwards you can actually see his entire upper eyelid. Liposuction of the waist is another common issue. The love handles in the back, the abdominal fat below the belly button in the front. We use Smart Lipo here, which is a machine that helps to dissolve the fat for easier extraction. It breaks up the fibrous tissue that holds the fat in place, and it heats up the skin, which gets the skin to retract better. Once again, you wear a compression garment for about 6 weeks. You can return to work next day with this, full activities in 3 weeks. I actually had liposuction done when I was younger. I played in a father-son baseball game 4 days later. Nobody knew the difference. I guess they know now. So here's before and after of liposuction. He has quite the tan in his after pictures after a trip to Cancun, but it really did change the shape of his waist. So thank you for tuning in.